Hi everyone, and welcome to Nairita's Talk, dedicated platform to help you all find the right insights and the right information in the beauty and aesthetic world. Bringing education, sharing the latest technology, and introducing you to the best doctors. We are very fortunate today to have Dr. Dany Kayle with us to share his fruitful insights. Hi, Doctor.
Hi, how are you?
How are you doing?
Fine, thank you.
Good.
Thank you for having me.
So, Doctor, tell us more about your career path and who is Dr. Dany Kayle?
I've been in the UAE for the past 20 years. I've started here, I established my career here as a plastic surgeon. And we started gradually from starting as an alliance, and I moved to Dubai in like around 15, 16 years ago. And ultimately, I ended up establishing my own center, which is Dr. Kayle Aesthetic Clinic, which covers all what the woman will need, from plastic surgery, including dermatology, beauty advices, as well as gynecological problems.
So today we'll be covering the non-surgical face rejuvenation. So can you tell us more about this procedure?
Usually now the trend has become that ladies are going away a little bit from the surgical or aggressive intervention, and then we have to honor that request and give them what they really want. So not everybody is willing to go under surgery and to withstand the sequelae of surgery as far as the downtime is concerned, hospitalization, general anesthesia, and so on. So of course, now we have in our armamentarium of plastic surgery tools, we have new techniques that we can use on the lady to give her a better look without having to resort to a surgical approach.
So basically, we're trying to shift from invasive to non-invasive.
To less, even non-invasive.
Yeah. Can we talk more about the prospective treatments? What do you mean with the non-invasive?
Usually the aging process consists of three pillars. You have the skin laxity, you have the loss of volume, and you have the problem with the skin texture from the outside. And so we have to tackle all these three. So if you want to address first skin laxity, and you are here talking about non-surgical approach, so we have kind of, logically speaking, to lift the skin up. How can we do that without surgery? We have to use something, now what we use is the threads. These threads are made of same material that we use for suturing. However, they are put in a way with a needle without having to open the skin. And they have kind of like hooks that will hook to the skin from below and lift it up. Okay, this is non-surgical. This can be done. This can solve a little bit the problem of skin laxity.
So this is for the lifting.
This is for the first problem. Okay. Now, we have the other problem is the loss of volume. So here you have to replace the volume, which you lose with time. So it can be done with the hyaluronic acid fillers, or you can do it with fat, which is longer lasting. Hyaluronic acid filler, as you know, it's going to be like for 6 to 8 months, okay? And then you can use it very safely, and we insist to use only hyaluronic acid fillers. We don't like those permanent fillers, and it's really a big no-no to use permanent fillers. So we use only hyaluronic acid fillers, and this will last like for 6 to 8 months. However, if the patient wants a longer lasting material, then we resort to fat, her own fat, which is completely safe, and then we can fill the necessary areas, and she has no sequelae or no problem.
Longer than hyaluronic acid.
And this way we are going to solve the volume problem, and then we are left with the skin texture problem, all the problems that occur for the lady on the skin from the outside, and this we have to do the peeling thing. And here comes the role of the laser. I prefer the laser. You can do it with chemical peeling, you can do it with the lasers. They are both kind of two different ways of tackling skin texture problems. However, I'm more used to
I know one of your signature treatments that you are also like, I heard a lot about this fractional laser CO2.
Exactly.
And can you tell us more about this treatment, doctor?
Usually the idea is to get rid of the aged, tired layer of skin on the outside, okay? And the laser what it's going to do is going to evaporate or remove that layer on the spot. You're going to remove it all. And then the body will come to renovate that skin and rebuild it, give you a new skin on the outside. It will be devoted of all those kind of blemishes, all those kind of problems, the fine lines, the pigmentary issues, all this will be gone by that treatment.
How many sessions do they need to just see the final results?
This is dictated by how much downtime the lady can afford. If the patient can tell me, okay, I can stay like 2-3 weeks at home, then we can be more aggressive and then we can do it in one session.
Is it a painful treatment?
Usually controlled by local anesthesia. So of course, during the procedure, it's going to be
What's the duration of the treatment with the fractional laser?
like 25 minutes if you are doing the whole face.
Okay. So the downtime is 1 to 2 weeks. And it
It's what
depends on
what I
the
was saying.
aggression.
If the lady has the time, she can have the luxury of staying at home for like 2 or 3 weeks. Then we can do very aggressive, and then you can do it in one session. However, sometimes the lady she's a working lady, she cannot. So usually we can do kind of in stages, and then we can lower the power of the laser and do like shallower peeling sessions, and then we have to do like few sessions every 2-3 months.
Okay. And is there any side effect that we should know about?
Everything that we do has side effects. So we have to always to be in check. Even if you are using the filler, you cannot, for example, overfilling is a side effect.
Yes.
So you have to control what is really needed.
Again,
for the
fractional
laser,
laser, because they always ask me, I'm not very familiar because I've never done it, but I've seen videos. But the question is like they always worry about having some burn and the side effect or the pigmentation or the
that's why we should
discoloration.
prepare the skin before using the laser. The laser is kind of a aggressive tool. Okay, I always tell my patients like it's like going to the gym. You cannot go to the gym and just start lifting 100 kilos. Okay, you should start with small weights, and so whenever the lady is prepared to go for a laser treatment, we prepare her before that. We prepare the skin with some kind of peeling creams, like for 3-4 weeks, and this will prevent having the complication of pigmentation problems or burning issues. And
so basically, you give them the peeling creams,
mild peeling creams, and
preparing the skin to go
and
to
with
more
some
aggressive.
with some creams to control the pigmentation. So it'll be a combination of pigmentary control and peeling cream, and this will kind of prepare the skin for the laser treatment.
So, doctor, there are a lot of common mistakes nowadays. Can you just tell us more about these common mistakes you're facing nowadays?
Usually, what can go wrong in our profession is when we overdo things. Usually, always to be conservative is always better. More is not always more. Sometimes it's less. So we have to really study the case, give the patient time to express what she really wants, and to give her exactly what she needs, no more, no less. So whenever you try to overdo things, and then the problems happen.
But some of the patients they could be very stubborn and they won't be convinced.
It is where our role comes to say no. We should say no whenever we think that whatever the patient is requesting is not good for her or is not turned out to be good looking on her face or her body, whatever.
If you face any complication during the treatment or post-treatment, how do you handle it, doctor?
Usually every procedure has its known complication, and then we know already what to do if that complication happens. Or if we are talking about infection, if we are talking about kind of, for example, if you are doing like a Botox for the eyebrows, and then like sometimes an eyebrow comes to happen higher than the other eyebrow, so you always know what to do. So this is where experience comes in. So whenever you are dealing with a doctor who's already he's well experienced in his profession, and of course everything like this, like infection problems and with the surgery happens, then the whole trick is to know how to handle that complication. And it's very important to stay by the side of the patient until everything is finished, and not to
ignore the
situation.
There are many plastic surgeons nowadays. How do you advise people to choose the right ones?
First, the patient should make sure that the plastic surgeon she is going to is already adequately certified in plastic surgery. Second, the best thing or the best referral is a word of mouth. She should know that from other friends, other people who have been with that surgeon and who have had experience with that surgeon, to give her kind of an idea about the surgeon. This is very, very important. Also, she has to know that she has the number of years of experience that this surgeon has. Going to a surgeon with 20 years of experience is different from somebody who's just beginner. Okay? So all these criteria will help in choosing the plastic surgery. And then the patient should be a bit careful about advertisement. And with these days, there are lots of advertisement. Anybody can advertise. Anybody can use social media the way he or she wants. So we have just, again, to follow the first 3 points I said, in order to filter out what she can see, what she can see on social media.
It's a very valid point.
Yeah.
What are the latest trends that you would like to tell us about for 2020?
Usually in plastic surgery, the trends are they are slow to develop. You don't have like a yearly trend. The only thing that I can say really that for the past 2-3 years that we are going, as we said at the beginning of our conversation, that we are a bit shying away from the aggressive approaches. We are going, all the ladies, all the patients, even men, are going more for non-invasive approaches, and they are going to for things which are really simple, kind of things that can be done in the clinic, and this is what's going these days.
And it's a good way to maintain all the time, to not reach to a point where they need the plastic surgery.
Exactly. We can, with the non-surgical rejuvenation of the face, we are delaying the need for a facelift for like 5 or 10 years more. So we are doing it at a later stage.
Thank you so much, Doctor. Thank you for accepting our invitation.
Thank you.
And hopefully we'll see you in your clinic.
Hopefully.
And see, I'm very interested with the fractional laser, CO2.
Sure.
And probably we'll have a live demo there. Thank you. Thank you,
Doctor.
Doctor.
Bye-bye.